Hi, my name is Jen Livingston, and I'm here today in support of Senate Bill 23093. So that's a Colorado Senate bill, and it was just introduced on January 30th by 3 Colorado senators. The point of the bill is to protect Coloradans from financial strain and financial ruin due to medical debt and collections practices. So the bill actually caps interest charges that collection agencies can collect at 3%. And that's on medical bills, and medical bills are defined as services, products, and devices that are charged to patients. It does require a good faith out-of-pocket estimate as well for patients who are self-insured. So if patients are also known as uninsured or not participating in the insurance market and private pay, they can go to a provider or a hospital and expect to get a good faith estimate of what the charges will be for the services they're asking for. It's also requiring that actual charges don't diverge drastically from that estimate. Then it also requires providers to offer a payment plan to patients that is acceptable and also affordable to them over a time frame that's suitable. If that payment plan does default, then the payment plan will spell out clearly what default means, and what happens next is that it would go to a collection agency. However, a collection agency can't, or under this bill would not be able to collect on a bill that was being disputed by the patient. So in an emergency situation where they get a bill for services that they did not receive or for medications they did not take, etc., say that bill was then disputed, a collection agency could not be billing on that disputed bill. Lastly, a debt collection agency has to provide an itemized list to patients of the different charges that they are collecting on. So in this way, patients are able to begin to know how much they're going to be charged for what services, and then anticipate an ability to set a payment plan at a reasonable 3% interest rate that they can pay for. They can also expect that if something in their life changes and they have to default on that debt, or for whatever reason are unable to make payments on that debt, that yes, it will go to collections, but they will be told what is going to collections, and there will be a 3% interest cap on those collections. The point is that Coloradans deserve access to care that they can afford at rates they can afford and understand. And Coloradans do not deserve to have to choose between rent, food, and health care in order to live here. And also, when collections happens, it should be clear and understandable and negotiable for patients. These are patients, people with illnesses and injuries that we're talking about. It's not a car. So I'm in support of SB 29093. It's a common sense step forward in protecting Coloradans who find themselves as patients and who are subjected to our current fractured and confused healthcare system, wherein right now they're without any protection from a myriad of variables and unknowns that can happen. Even an astute consumer of healthcare products in this marketplace can easily find themselves receiving services that are out of network, even if they're in an in-network hospital that provides services mostly by in-network providers. If they have an emergency and an in-network cardiologist is not available, they'll get an out-of-network cardiologist, and that cardiologist can charge whatever they want, and the hospital will bill the patient for the difference. So even patients who are paying those premiums, paying the deductibles, paying the copays, and doing everything they're supposed to do within this current system can find themselves in a situation of excruciating and unmeetable debt. And patients deserve to have some protection from losing everything just because they had to go to the hospital. The effects of medical debt are well documented. As I explained, and the average annual national cost of family health insurance is an astounding $22,000 a year, whether or not services are used. Meanwhile, Coloradans in specific are experiencing a cost of living that's 12% higher than the rest of the national average. 14% of Coloradans right now report having difficulty in paying their medical bills. 12% of Coloradans, 12% of us, have medical debt in collections to the tune of $1.3 billion. The amazing thing is, most of that debt is for amounts less than $1,000. But with inflated insurance rates and unclear billing, those debts can go unanswered for a very long time. So this bill is not saying we shouldn't have debt, that we shouldn't pay the cost of our medical care. What we're saying with this bill is that we want to pay justly, we want to pay fairly, and we want to know what we're paying for, and we want to be able to pay for it with a reasonable interest rate. And unfortunately, but predictably, the debt burden in Colorado does unevenly lie on young families with children, people of color, and veterans. So it's our young families trying to make it, it's our veterans who fought for our country, and our people of color who are unfairly burdened with this debt. SB 093 follows up House Bill 211198, which was enacted last year. That bill goes a long way toward making sure that inpatient situations, so hospital situations, cannot overbill, that they screen for Medicaid, and they screen for financial services, financial assistance programs within each hospital. So that bill does the same thing on the inpatient side of making sure that when patients come in the door, any available help to them, any financial assistance to them that they qualify for is made accessible to them so that they can pay for their care, and so that our hospitals and our providers can get reimbursed for care that they by law have to provide anyways. So we're making sure our system is whole. We're making sure our system is paid, people can pay for their services. And this bill, this Senate bill, backs it up by saying, well, when people can't pay, there's a way forward still that doesn't require them, to claim bankruptcy and go into debt or not be able to buy food and put meals on the table for their families. So while liberals and conservatives have different views on the ultimate fix for the healthcare system, we're not talking about the ultimate fix here. We're talking about a very simple, a very common sense, and a very supportable way forward to make sure that our brothers and sisters here in Colorado, our veterans, our young families, can move forward and move through life without having to claim bankruptcy because of medical costs. We understand that navigating that system is very challenging, and that even when you do all the things right, you can still end up with medical costs that you can't pay for. And so this bill at least has some footsteps, some common way forward for people to be able to understand what they're getting billed for and understand how they can go about paying for it without, again, claiming bankruptcy or just maintaining these, Menini debts over years and years and years because of high interest rates. Another thing to consider is that 9 out of our counties in Colorado are rural. and they have household incomes of less than $40,000 a year. So depending on the size of those households, they may not qualify for Medicaid, but certainly can't afford medical debt at $40,000 a year. So it's important for us to recognize that, those Republican-held counties are important to Colorado, and the people in those patients are important to Colorado. It's also important to recognize that those people, our rural neighbors, are people producing for our people, are 60% more likely to be involved in a trauma and incur huge ground transportation costs from that. So emergency medical services have a hard time in rural and mountainous areas in Colorado because it's difficult to maintain and pay for emergency responses. And so those costs are very, very high. So they tend to get help, out of network help, for those emergency services. So 70% of emergency ground transport in Colorado incurs out of network bills, which again don't get paid for, even if you have the best insurance plan you can find. And who's going to be most impacted by that? The people who can least afford it in our rural populations. So Colorado has a Democratic majority in 2023. This is a democratically sponsored bill. So it's probably fair to assume that it will be a democratically passed bill. But I think it would show so much goodness for our Republican teams, our Republican Party, our Republican people here in Colorado to recognize that this is not a bill about fixing the healthcare system. It's not a bill about socializing the healthcare system. It's a bill about making sure that our backbone, the people that we know and love, our neighbors, our rural communities, are not bankrupt by a system that they can't afford. And that's really what I'm asking, is for our leadership on both sides of the aisle to recognize that this is not a partisan issue. This is a people issue. This is a patient issue. This is a people trying to navigate life and not, be bankrupt or overburdened by medical expenses that they can't pay for without some real ground rules. And I'm sure that, with reasonable interest rates and a policy to be clear about how you can pay for the services that you incur, Coloradans are hardworking. We're trustworthy people. We will pay our bills. We just don't want to be taken advantage of while doing so. Thank you.